Achoo! Pardon me. Now that was the sound of me many summers ago when I had symptoms of a runny nose, tickly throat and watery eyes, and I thought, I've got the flu, but this was summer, how can I have the flu? Now I went to the doctor and the doctor said you've got hay fever and gave me some Piriton and said take this, and I was like, but what, hay fever? First of all, I don't have a fever, I wasn't hot or cold, didn't have a temperature, and also I had not eaten or consumed any hay. So I've never heard of hay fever, and the doctor never really explained to me what hay fever was. And that was my start of some miserable summers. So every summer was miserable. But now I only have hay fever, which would usually last about a week or two. So now I'm going to tell you more about hay fever and how to manage the symptoms of hay fever. Now, hay fever was actually previously thought in the 19th century to be due to a reaction to the odor from newly mown hay. But now we know that this is not the case. Now, there are two types of hay fever: seasonal hay fever and all-year-round hay fever. Seasonal hay fever is due to allergy to protein powder particles called pollen, which is found in trees, grass and weed. While your all-year-round hay fever is due to a reaction to mold, house dust mite, fur from pets and cats, and feathers. Pollen are fine powder particles released from tree, grass and weed. When the pollen gets into the eyes, nose and throat, the immune system thinks that the pollen is harmful to the body and releases chemicals called histamine. Now what the histamine does is to attack the body, causing the swelling and other symptoms we get with hay fever. People can have symptoms depending on which pollen is released, and some people have hay fever symptoms that can last weeks or even months. Now we know that pollen from trees usually occurs between February to June, while grass pollen occurs between May to July, while you have weed pollen which occurs from July till September. Now if you have any of the symptoms, it's most likely you've got hay fever, such as sneezing, itchy throat, watery and itchy red eyes, running and itchy nose, nasal congestion, cough, postnasal drip where you feel the mucus dripping from the nose into the back of the throat, allergic shyness where you basically experience swelling in both eyes, and feeling very tired. Severe symptoms such as wheezing, chest tightness can also present in people who have asthma. In terms of risk factors, if you live in a highly polluted area such as the City of London, you're more likely to have hay fever than someone who lives in the city. For example, when I lived in London, my hay fever was very bad. My summers were miserable, but as soon as I moved out of London, I only have fever which usually lasts about a week or two. What happens is that in areas where there's high pollution, the air is so dense and thick that there's nowhere for the pollen to go, that it gets trapped and it gets into our airways, which causes the symptoms that I've just mentioned. Now, preventing hay fever can be very difficult when you're exposed to environments with high pollen counts. You can reduce your symptoms by monitoring the daily pollen forecast. This tells us when to stay indoors or go outside. Keeping all doors and windows shut in the house. Use of air purifier helps us to filter the pollen trapped indoors, but can be costly. If you have pets, bathe them weekly or get someone else to do the brushing. Vacuum your carpets every week. Avoid areas with lots of grass and trees, especially in the early mornings and evenings. Now, if you're outside, when you come indoors, make sure you change your clothes if you've been outside, especially in the park or in the garden, and take a shower. Petroleum-based cream such as Vaseline, applied around the nostrils, helps to prevent entry of pollen into the nostrils. In terms of treating hay fever, ideally you want to start 2 to 3 weeks before your hay fever symptoms actually start, because it takes a while for the medication to actually build into the system. There are different ways of treating hay fever. You can treat hay fever using medication, or you can go for the natural way. Now let's talk about medication. Now, hay fever treatments come in different forms, such as liquid, drops, spray, and tablets. Now, you can have a combination of 1 or more items depending on your symptoms of hay fever. I would usually advise using 2 or 3 combinations. Now, let's talk about this. Now, I'm sure most of you have heard of antihistamines. These work by blocking the histamine receptors that are responsible for your symptoms. We have the non-drowsy and the drowsy medication. For example, the non-drowsy would include Loratadine. This can be taken once a day and will not make you sleepy. Whereas we have the drowsy medications such as Piriton, which can make you sleepy. If you look at the children's version, we have Piriton. So for the age of 2 to 5, you can take 2.5 ml up to 6 hours a day. However, I would not recommend this if your child is going to school, as your child will fall asleep in class. So alternatively, you should give your child either Loratadine or cetirizine. This can be taken once a day or twice a day, depending on how bad the allergy is and the age of the child. There's also the adult versions of cetirizine. If you have a blocked nose, you can use spray, so-called oxymetazolane hydrochloride. This is very helpful in blocked nose. Now, if you've tried Loratadine, cetirizine and Piriton and you've not found them to be very effective, you can advise your doctor to prescribe you fexofenadine. Now, fexofenadine cannot be found over the counter and is prescription only, but this I have personally found to be very effective in dealing with hay fever. When I take this, within a day or two, my hay fever symptoms are gone, as opposed to a week with Loratadine or cetirizine. Now, steroid spray work by reducing the swelling in the airways and are very effective, especially when combined with antihistamines. An example of a steroid spray is called Avamys or Flixonase. These are very effective steroid sprays, but have to be used 2 to 3 weeks before the symptoms start. Now, the dose on steroid is actually low, so side effects are minimal. So in terms of combination, I would advise you to take an antihistamine tablet such as cetirizine or Loratadine, take a steroid nasal spray, and use eye drops. Now, eye drops such as Opticrom are very good for itchy or watery eyes. Now, if you've got pollen trapped in the airways, I would advise you to do Saline washouts. You can buy something like Sterimar spray, which you can use to irrigate the airways and wash all the pollen out of the nostrils. In terms of injection, there's an injection called Kenalog, which works by suppressing the body's immune system to histamines. This is a high-dose steroid with side effects such as raised blood pressure, muscle weakness, and can cause fractures of the femur. This is not available in NHS and is only obtained privately. This can last in the body for up to 8 weeks and can suppress your immunity to fight infection, so this is not something that we recommend to use. Injections such as Kenalog are reserved for severe symptoms and can only be given by an allergy specialist. So if you have very bad allergy, ask your GP to refer you to an allergy specialist. Now, the most common questions tends to be, what Hayfever medication can I use in pregnancy? Now, you can use any Hayfever medication in pregnancy apart from Piriton. Now, Piriton, especially in the 3rd trimester, can cause shaking and irritability in babies. Steroid nasal spray, Loratadine and cetirizine is safe to use in pregnancy. Now, if you want something free from antihistamine and steroids with no chemicals in it, I would recommend using Prevalin allergy spray. This is an option that works as a fine gel that coats the nostrils and prevents the pollen from getting through. Now, if you're not keen on medications, what about home remedies? I would recommend using a spoon of manuka honey every day. Now, you have to use this before the hay fever season starts to build up your immunity. What some people do is they take honey and contaminate it with local pollen, and they find that this prevents hay fever. Foods rich in omega-3 help to reduce swelling, while garlic contains natural antihistamines and anti-inflammatories. Fish, seafood, nuts and seeds are good examples of foods rich in omega-3. Green tea, chamomile or English breakfast tea contains antioxidants and anti-inflammatories. I would also add some manuka honey to the tea. Now, if you're unsure about what type of medication to use to hay fever, or you're pregnant, or you have an underlying medical condition, I would advise you to speak to a pharmacist, a doctor or a nurse before you take medication. Also, if your symptoms persist or are not relieved by medication, do not assume it's hay fever and speak to a doctor for advice. This is because there are other medical conditions that can cause symptoms similar to hay fever. Also, we have what we call nasopharyngeal cancer, which can present with symptoms of hay fever. So I'll definitely advise you to speak to a doctor. If you have any further questions about hay fever, feel free to drop comments or send me a message and I'll reply. Right, so now I guess it's time for me to take my medication.